Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today's topic is ADHD.
ADHD is a medical term. It's described a wide variety of disorders for kids who have difficulties with their attention, or they're hyperactive, or have problem with organization. So the term describes those symptoms. ADHD stands for Attention Deficit Hyperactivity Disorder. Think about it as a child who has a brain that's like a racing car brain with the brakes of a bicycle. So there is a mismatch between what their brain is able to do and their ability to kind of regulate it.
What are some symptoms to look for when diagnosing ADHD?
Inattention, hyperactivity, and impulsivity, those are the symptoms we look for. The kids who are unable to pay attention to certain things for extended periods of time. They can't multitask. They kind of jump from one thing to the other, and they can't sit still. They need to kind of keep moving. They have difficulties remembering things, and misplaced things. Those are some of the symptoms that we look for.
Do kids outgrow ADHD?
A lot of kids kind of grow out of it and then have more ways to cope. But what happens, it doesn't go away. The wiring of the brain is still the same. It just kids can find different ways to cope. So they're kind of learn how to sit still. They know more ways to kind of be more organized and have tricks to kind of remember things.
How does ADHD get diagnosed?
There's a certain amount of symptoms that has to be present before we diagnose. I think the most important part of that diagnosis is finding how much of these symptoms are impairing the kid's ability to function. So the diagnosis is mostly clinical. It's about meeting with family and the child, and then get some feedback from the school, try to kind of get a sense of the symptoms if they're present, and then how much are they impairing the kid's ability to function.
What are some treatment options other than medication?
Medication is not the only way to go, and we certainly don't start with medication. Most of the kids that we see, we try to kind of find more non-medication tools to help, and that includes the education, trying to work with the school, and work with the parents to kind of have some techniques to help them again bring the kid closer to that middle ground we talked about between their symptoms and what we expect of them. So there are a lot of parent training that we use, and try to kind of work with the teachers to kind of implement some behavioral interventions and more of making the kids aware of their body and ways to kind of calm themselves before we kind of jump to treating them with medication.
Are there any tools or techniques to help those with ADHD?
Some of the techniques we ask the families to do is plan ahead and just kind of be prepared for changes. Kids with ADHD prefer to know what to expect. They don't like surprises, and I think that's one of the things that we try to come up with the family, have a schedule of things that you do and what you're planning to do, a daily routine, have it written down, or if the kids can't read, maybe doing in a way pictures or things that would help them understand what to expect, and kind of stick to the routine as much as possible. When there are any changes, give the kids a heads up, and find ways to include that in their routine. We also think of consequences, thinking about having first the instruction, what do you expect of the kid? You need to communicate that to them, make them repeat it so they understood what you said. Try to be as concise and as short and as direct as possible. Look at them in the eye and talk to them about what you expect from them. And then when there's a bad behavior, kind of apply the consequences and then kind of move on to the next thing. From the studies that we've done now, we know now kids who are connected are better off with long-term. So we tell families like, to kind of stay connected to their kids and know what there's going on in their lives, and like, be close to them as much as possible.
When should parents start being concerned if they think their child could have ADHD?
Talk to your school teacher. I mean, to find schools has a lot of structure, a lot of expectations, and that would be our first line, just to kind of find out if those symptoms are causing the kid to kind of fall behind. So their grades are falling back, they're getting in trouble, or they're getting suspended, or we're getting a lot of goals because they're getting injured, or they're injuring someone else, and because they're jumping off furniture and like, doing things that they're not supposed to do. So those are going to be our kind of like, litmus test. It's like, to find out if some of those symptoms are causing problems.
How important is your child's school in the process of treating ADHD?
ADHD is a school-age kid problem. Again, there's a big mismatch of what the kids are doing in the school environment. There's a lot of structure, a lot of expectations of the school, and without working as a team, I mean, there's really hard to, it will be really hard to kind of like, help the kid function well, which is our ultimate goal of the treatment. So working with the school, with the teachers, with the special ed like counselors, and with school, like the aides, and having a multidisciplinary team that includes everybody would be essential to kind of help those kids. Everybody has their own way. They're different. Their abilities like are different, and it's on us to kind of find ways to help them kind of find that middle ground between what we expect from them and what they're willing or able to do.